On average, the global cost of a data breach in 2023 is about $4.5 million USD. So as you can see, ensuring the security of protected health information, or PHI, can help defend your company from large financial losses. Luckily, we have the Health Insurance Portability and Accountability Act, or HIPAA. HIPAA is a federal regulation that protects the privacy and security of PHI. No matter what type of media the information is on, such as on a computer or paper, your company must adhere to HIPAA rules and regulations to protect it. The HIPAA Privacy Rule and the HIPAA Security Rule are two important subsets to understand when it comes to making sure your organization stays HIPAA compliant. These terms may sound interchangeable, but don't let them fool you. They both have their own distinct roles to play when it comes to HIPAA as a whole. Hi everyone, I'm Maria from eTactics, and today I'm going to talk about HIPAA Privacy Rule versus HIPAA Security Rule. Before we get started, make sure that you subscribe to our YouTube channel by clicking the button below. Also hit that alert bell icon so that when we post new helpful content, you get notified. The HIPAA privacy and security rules are essential when it comes to keeping information safe. These federal standards and regulations apply to everyone who handles PHI, but what is the difference between them? Let's start with the Privacy Rule. The Privacy Rule standards address the use and disclosure of PHI by organizations, as well as standards for individuals' privacy rights to understand and control how their health information is used. HIPAA Privacy Rule requirements apply to most healthcare facilities and providers, including those who don't have electronic health records, or EHR, as well as those who do not participate in a Centers for Medicare and Medicaid Services EHR incentive program. Protect sensitive health information by setting a federal floor to do so across all mediums, limits how healthcare providers may use PHI they receive or create, gives rights to patients when it comes to their PHI. This includes a right to look over and obtain a copy of their medical records, also the right to ask to amend their record if information is inaccurate, enforces requirements for administrative teams, including training of employees, establishes civil penalties. Now that you know a little more about the Privacy Rule, let's move on and look at the Security Rule and see how it differs. The HIPAA Security Rule has the same basic idea in that it helps to protect patients' health information. However, this rule covers electronic protected health information, or ePHI, specifically. ePHI includes what a covered entity creates, receives, maintains, or transmits in electronic form, mediums such as emails, texts, and so on. All this information falls under the Security Rule. Security measures implemented through administrative, physical, and technical safeguards help to ensure the integrity and confidentiality of ePHI. Some examples of these safeguards include security management processes, facility access controls, and transmission security measures. There are plenty more examples, but I think that deserves its own video. Although it is impossible to guarantee you will never be a victim to a data breach, by following the proper guidelines, you can reduce the risk drastically. Remember, any healthcare facility that handles PHI or ePHI is responsible for complying with the HIPAA privacy and security rules. If you'd like to learn more about HIPAA privacy and security rules, reach out to eTactics. And you already made it this far into the video, so you might as well like it, share it, and comment below.